As the weeks and months start to cool down, the threat of the flu season starts to heat up, and more doctors say now is the time to start considering a flu vaccine. Dr. Kevin Campbell here to discuss that. Doc, good to see you.
Good to see you, Phil.
All right, so I guess the big question, when does the flu season officially begin?
Believe it or not, flu season starts really now. October through May is when we see flu season. Really peaks in January and February, so it's important to start thinking and preparing now.
Is there anything we can do to prepare for the upcoming flu season?
The most important thing that you and I and everyone else can do is get a flu shot. It is incredibly important. It is very important for people at particularly high risk, which would be people 2 years or younger, and the elderly, as well as people with chronic illnesses like diabetes, heart disease, lung disease, asthma.
I don't like getting the flu shot. I'm sure I'm not the only person out there, right? I mean, but you recommend this. This is a very important thing.
It is absolutely important. A couple of myths. You cannot get the flu from getting the flu shot.
Okay.
It is an attenuated virus, meaning it's a dead virus that our body is able to make antibodies against, and that's why it works. Anyone that is 6 months of age or older, all the way through the elderly, needs a flu shot. It's very, very important. There are options. You can get a nasal spray. You can get a needle that just goes under the skin like an insulin needle and it doesn't hurt, or you can get the intramuscular injection.
Let's say you did a good job this morning and a lot of our folks at home, our viewers say, okay, I'm going to get the flu shot this year, I'm going to get the nasal spray. When is it available?
So we actually are starting to see it now. You can get it at pharmacies, you can get it at your primary care doctor's office. Just call around. We know that they all shipped out in August. They're available now. 136 million doses are already on their way to your doctor's office.
And this year is a little bit different than years past, right? Because it protects against 4 strands this year, right?
That is correct. So there are 2 major types, type A and type B. Type A is the one that really makes people ill. Type B is a little milder. We know already that we have strains, vaccines against type A 1 and 2. Now we have strains against, protection against strains B1 and 2. So it's important to ask which one you're getting.
Coming a long way.
Exactly.
Doc, good to see you.
Good to see you. Get your flu shot.
Maybe I will. Maybe you convince me. We'll see. All right, so and if you have a medical question for Dr. Campbell, really easy. Just log on to our website, WNCN.com, search links we mentioned. From there, you can like his Facebook page, and also you can find his Twitter page as well.